What is cholestasis of pregnancy? Cholestasis is a condition where bile flow is slowed or blocked. In pregnancy, cholestasis affects the flow of bile from the liver to the gallbladder and into the small intestine. The main symptom is a yellowing of the skin and eyes, jaundice. Cholestasis can be a serious condition, but most women make a full recovery. The condition affects 1 in every 100 pregnant women. Cholestasis can be confirmed by blood tests. In some cases, your doctor may carry out a liver function test. If you have jaundice during pregnancy, you may be offered an ultrasound scan of your baby. This is to check the baby's health and growth. Treatment is often not needed and most women make a full recovery after giving birth. What are the symptoms of cholestasis of pregnancy? Following are the symptoms of cholestasis of pregnancy: dark urine, light-colored feces, intense itching. You may also have yellowing of your skin or whites of your eyes, and pale stools. Fatigue, weight loss, losing a lot of fat, nausea or vomiting. What causes cholestasis of pregnancy? Unsurprisingly, the cause of this condition is poorly understood. It's unclear whether genetic factors play a role or not. Occasionally, people with cholestasis of pregnancy run in families. There are also several genetic variants that have been identified as contributing to this condition. Pregnancy hormones cause a lot of notable changes during your pregnancy. Hormones rise in the body as you get closer and closer to delivering, which may alter the normal flow of bile that comes from the liver, which is responsible for helping to break down fats in the body. This can also lead swelling of your liver and eventually cause intrusions and buildups in your bloodstream. This can produce some skin rashes or itching as a result. Risk factors for cholestasis of pregnancy. Having had cholestasis of pregnancy before, a woman is 60 to 70% more likely to experience cholestasis again as compared to those who have never experienced it. Having a close family member who has been affected by cholestasis. Becoming pregnant after having undergone fertility treatments. If you're having twins or triplets, a multiple pregnancy. What food to eat to cholestasis of pregnancy? Foods to eat include lean meats, wheat, bread and pasta, seeds, nuts and healthy oils. Grains. What food to avoid to cholestasis of pregnancy? Following are the food to avoid: soy products, sugar, dairy produce, processed meats. Does cholestasis of pregnancy cause liver damage? If you have previously suffered from liver damage linked with cholestasis of pregnancy, then you are considered to be at a higher risk of developing cholestasis of pregnancy again. Cholestasis of pregnancy also carries risks itself, since it has the potential to exacerbate pre-existing liver damage, whether or not you've suffered from it in the past. How to diagnose cholestasis of pregnancy? Cholestasis of pregnancy is usually diagnosed during routine antenatal care. You'll have blood tests to check if your liver is working normally. Your midwife will also ask about your symptoms. During your pregnancy, your midwife will monitor you closely. It's important you continue to go to all your antenatal appointments. There are a few additional blood tests that a doctor can order to determine the liver's current state. One of them is the alanine aminotransferase, ALT test, and another is the aspartate aminotransferase, AST test. Treatment of cholestasis of pregnancy. Cholestasis of pregnancy is a serious condition and it is important for women to be treated as soon as possible. Treatment aims to relieve the symptoms of itching, jaundice and tiredness. The most common treatment for cholestasis of pregnancy is stopping breastfeeding. Other treatments include taking ursodeoxycholic acid tablets and intravenous fluids. The best way to prevent this from happening is through testing blood levels of the individual with a condition, so as to pick it up in good time if these levels start getting out of control.